I'm Dr. David Nace, Chief Medical Officer at Innovaccer. And I'm joined here by my colleagues, Abhinav Shashank, CEO of Innovaccer, and Tom Stanish, CEO of Story Health. Gentlemen, as I travel around the country and meet with health leaders, the one thing I'm struck by is their concern that specialists are overwhelmed and their patients often have to wait months, if not longer, to get an appointment. The end result of this is a capacity death spiral in which physician burnout meets patient access failures, and it impacts clinical performance and operational performance as well. At Innovaccer, we've learned one thing. We've learned that data, when operationalized, can result in patients being able to be seen by more clinicians, shorter wait times, better clinical outcomes, and a shift in the economics of healthcare delivery. There's one area that really hasn't seen that kind of a transformation, and that's specialty care. Specialists are overwhelmed, the demand is increasing, and yet the workforce is getting smaller. We're here to share a bold step forward in thinking about how specialty care can be transformed for the future. And we're also here to reveal something very special, a new chapter for Innovaccer and the way that specialty care will be delivered in the future. Abhinav?
Thank you so much, Dr. Nace, for that introduction. I'm very excited to announce that Innovaccer is acquiring Story Health today. When I met Tom for the first time and he talked about the mission that Story Health is on, it resonated so deeply with us at Innovaccer because we've been on this quest of figuring out like how data can basically be utilized to improve healthcare outcomes across the board. So we've worked with like hundreds of health systems and CIOs and chief medical officers across the country to really think through what are ways that we can use all of the data that we've been collecting over the last decade or so and put that to use to measurably improve outcomes across the population sets. And when we met Tom for the first time and he talked about all of the incredible things that he's basically been doing with his customers on improving specialty care outcomes and working and collaborating with these systems in a much more meaningful way, like with products, AI, services, all of that bundled together, it was just basically something that we thought like could be done so much better together. And so we're very, very excited to announce today that we are bringing the two missions together to really propel what specialty care could basically look like.
Yes, thank you, Abhinav and Dr. Nace. I do want to reiterate what Dr. Nace said. We just seen this massive challenge for patients and caregivers alike to really meet the size of the problem they're dealing with. You're dealing with a growing elderly population, and they have long-term chronic conditions they're trying to deal with that require a lot of care. And some of the stats are actually quite worrying. 25% of patients actually switch doctors because their wait line time is too long. So you can imagine you're going to see your doctor and you just can't get the appointment, so you go find another doctor. It's unfortunate. In addition, we see that in one of our core areas we work in, cardiology, 10% of patients that have end-stage heart disease do not get the actual medical treatment that they are supposed to get. Only 10% of them actually get that, which it's really a tragedy. And you can only imagine the long-term implications for health across our country because of that. So we're really excited to take this next step with Innovaccer.
You know, in a value-based care context, whether it's pay for performance, shared savings, capitation, avoidable readmissions can have a devastating impact financially. In a more traditional arrangement like fee-for-service, right? Clinical throughput for patients, access, being able to navigate the healthcare journey, and also challenges that are faced operationally can just eat away at margins. So we have a crisis in this country. And specialty care is the one area that really needs to be resolved. It needs to be transformed.
What we're sort of really seeing like at a population scale with all of the customers that we are sort of really working with, that the economic incentive of value-based care probably aligns technology, intent, economics, all of that together to pay for better outcomes. And we've seen that in our in the partnership with our customers that when all of these three things basically come together, you are measurably seeing better outcomes, and you're seeing that at lower cost structures. The ACO report that basically just came out saw basically billions of dollars of cost savings, while every quality outcome basically went up. So the construct of value-based care has worked really, really well in the small settings that it has been deployed at, and we think like going forward, it's basically going to be incredibly meaningful. Now, some of the challenges of value-based care that we sort of really have also sort of seen is that it's very only primary care led today. While basically like thinking about specialty care, which is a bunch of the cost structure, how do you improve access to specialty care? How do you sort of rethink about some of these things? Still remain massive problems to be solved, and which is where like I think like bringing the population level scale of Innovaccer together with like I think the deep expertise in specialty care with Story could just be such a meaningful shift in how care delivery like I think works. So I'm super excited about that. But Tom, like also your thoughts?
Yes, I'll tell you a little bit about what we're actually doing.
Yeah.
To be more specific, we've been building a new care model, really, a different way for patients actually to receive care, because the whole notion of going to see a doctor and having this appointment slot, there's just not enough appointment slots. So we can't keep up if we continue this old model. And we've been proving that at great institutions like Christiana Care, Intermountain, and Kettering Health, where we've been able to work on this together and actually publish our results in really data-driven ways. And fundamentally, what that new model involves is actually moving a lot of the care into the patient's own home, taking it out of the clinic and actually allowing AI agents to actually interact with patients to guide them through their process. And then bringing all that data back from both the home directly and from the clinical context into one view that a clinician can be able to make a quick decision, get the whole story right in front of them, and with a few minutes be able to make a big clinical decision and something that would normally take 20 minutes or longer. So those are two big parts of it. And then the third final thing is, AI is great, but we really still need to have a human touch for all of our patients. So we employ a new role we call a health coach, which is somebody that can be available for patients all the time to deal with all the barriers they're going to run into and be able to get that care. So these three main components, AI agents, combined data for the clinicians, and a new workflow along with a health coach, are really transforming the way that care is delivered. And we actually see great results from that. For example, our heart failure readmission rate, one of the big benchmarks people use in the industry, we've seen 7% is the number we've gotten for patients that are on our platform. Compare that to the national average around 20%. That's a dramatic improvement in the cost and the quality, because no patient wants to go back to the hospital. And hospitals don't get paid when patients go back to be readmitted. So everyone really wins in that situation. And we've also been able to see for every patient enrolled, we've been able to reduce the number of follow-up visits they have by 3 over the course of a year. So that's new appointment slots that are open for that clinician to be able to see new patients and do more procedures that patients really desperately need. So a lot of different things coming together that are really being proven out at some great institutions so far.
This is a wonderful story. And, I think about our 30, 40-year journey in this country to try to achieve the triple aim, right? We've focused on primary care as an infrastructure to how to get that care delivered in a more contextualized way, but we haven't brought the specialists into the equation. This is a wonderful opportunity to bring them together. And it's not just about software or technology. It's really about making care delivered in a better way, that's delivered more at home, connected with the specialty office, to having specialists more connected with the primary care. And regardless of the payment mechanism, we can start to make that transformation more coordinated, more contextualized, and more trusted for their patients. Tell us a little bit about the challenge you saw in the industry that needed to be solved and how you went about starting Story Health.
That's really interesting. We really worked with the academics to understand all the research that's been done, and it was very clear that people knew there was a problem. They know that they can't deliver the care that they want to, and it's been shown in registries for years. But they always thought that the problem was maybe we need to educate physicians better. But every physician I talked to seemed to know the problem. So it was kind of this loop that people would get into. Well, maybe we just train people better, they'll do better. And the real unique insight that we had was it's not about that. It's about a new model of delivering care. It's about changing the script for how a physician actually practices medicine to be done in a way where they can actually affect a lot more people in a shorter amount of period of time by having the right data systems, AI, and other things brought together, along with a team that can really help them affect their change across a larger population. That was a real insight that began Story Health.
And so much of care delivery occurs in the office, and you've talked about how do you bring the patient in their home and their family into that equation too. How did you think about technology that's been there for a while and how that could be leveraged, how it could be pulled together and operational?
Yeah, there's lots of different programs out there, from everything from measuring vital signs at home to texting questions to your doctor, but it's all kind of like individual pieces. The pieces together, though, can really be put together to run a program that has a destination and a goal and a pathway that's related to guidelines that actually is best practice. So that was, I think, the magical point was saying, let's take all these pieces and use them together to solve a problem clinically, rather than do each one of them individually, potentially really well.
And Abhinav, I know you've come from a technology background and you've been working in healthcare for over a decade now. You've seen all the problems we have in healthcare. How have you thought about solving this problem where physicians often don't follow guidelines and they often blame their patients for being non-compliant? And we really need to get a better place where we're doing things in a more consistent, reliable way. How has technology helped us do that?
Healthcare is not a one-person sport. Like it's not one person who's treating you. It's a team sport. And so for the healthcare outcome to eventually get delivered, you need the doctor to be doing the right thing. You need like the health coach to be doing the right thing. You need basically like I think the patient to be doing the right thing, and you need the patient's family to be doing the right thing. And so if you really want all of these things to basically come together, you also need a connected information fabric to exist, which is what we've sort of been trying to say, that we've all been wanting to get like AI into healthcare, but we really don't have internet in healthcare. So the first problem that if we could solve is like creating that internet layer or that information highway on top of like the existing systems that exist. That could basically be a major leap, and then on top of it, like magical things can happen. And one of that examples is what like I think obviously Tom has been doing to connect the home to the hospital, to the primary care site, and making all of these people work together for a common outcome that this patient needs to get better.
I know that Story Health is really focused on these specialty care context problems. So one of the issues is medications, medication adherence, having the right medication protocol. How is Story Health taking a look at that today?
When I think about medication adherence in particular, there's a number of different things going on here, not just patients not remembering to take their pills. That is the tip of the iceberg of the challenge here. Part one is, are patients even on the right dose of their medications? A lot of times they're not. They're on either a starter dose or maybe too much of a medication. So getting that right first is one of the important things. So being able to guide clinicians through what the patient's feeling, how does it relate to guidelines, like you said, with the data, that's step one to really be able to affect that. The next thing is that a lot of patients actually struggle to afford their medications, and that can lead to a big adherence problem. So being able to offer a health coach that can help you figure out which programs are you actually eligible for that can help you with affordability, that's part two. And again, the other thing the health coach is there to do is help patients understand the third barrier, which is patients sometimes don't realize that their medications are there to help them, and sometimes they think they actually do more harm than good. So having a health coach there to actually re-educate our patients as to, hey, this is doing something for you and this is how it works and why it works. That's the third barrier. And then finally, the last thing we see a lot of is symptoms. A lot of side effects and symptoms from medications can be very challenging for patients. So being able to monitor those symptoms at home and be able to make changes without waiting for that next appointment 6 months down the road, that will make a big difference in adherence. So those are the things that I think are really practically being done at Story Health to address this problem.
That's a wonderful story because you're now making care continuous, right, throughout the day for the patient whenever they need it. Are you thinking about how you connect with the other caregivers, the husband, the wife, the people that are important in the family's life?
Yeah, that's the first class part of what the Story Health experience includes is the family member who, for like about 40% of our patients, it's not the patient that's actually interacting with our team. It's actually their family members. very common. And I have a story about this that I think really brings it home. There's a patient, one of our first patients, her name is Christine. It's not a real name, but she had heart failure. She was 65 years old, and she had a lot going on in her life. It was quite complicated. She had her mother she was taking care of, who was in her 90s, and she had her sister who had cerebral palsy living at home. She was taking care of a lot for her to take care of, on top of the fact that she herself had heart failure. And she also was working an hourly job. So you can imagine having to take out time off of work. That was to go see her doctor. That was lost wages for her, time away from her family, really challenging. And so she missed a lot of appointments, unfortunately. And the system, as it does, really struggled to figure out how do we best deliver care to this patient. And so they kind of got labeled as non-compliant as a patient, right? And you can imagine there's a lot of downstream implications for having that label. So at an appointment she actually was able to make it to, she got enrolled into a Story Health program. And she immediately met Josephine, who's a health coach who was on our staff. And Josephine helped her figure out how to get started on her meds, and then started her on a rapid medication optimization program where they changed her meds every 2 weeks and helped measure her vital signs at home to make sure she was doing well, understand her symptoms. And it turns out that Christine was the model patient, because she could do all this work on her way to work, in between taking care of her mom. It really kind of fit her life better, rather than having to, really only interact with the healthcare system in this one appointment-based system. So she became a model patient and lost the label. And of course, unfortunately, the way this disease goes is it gets worse. And patients, unfortunately, it's one of the leading causes of death in our country. And Christine got worse, and she actually needed advanced treatment. Because the system knew her and was so confident, she was actually able to get an advanced procedure called an LVAD that was basically half a mechanical heart to keep her alive for many more years. And she would never have been able to be given that option if she hadn't had Story Health with her to convince the system that she was going to follow through. She was able to receive the care. So that's like one of my favorite stories about just like how the model can be very different.
You know what I love about that story? It really talks about how you move away from blaming the patient when you don't know anything else, and the patient doesn't have the tools or capacity or information to manage their care, to forging a true partnership between clinicians and patients to really resolve their care in a continuous way. Abhinav, as an engineer who moved into healthcare and discovered the enormity of problems that we face in healthcare today, what gets you excited about this partnership?
I think the stories that Story is enabling is incredible, right? And all of us basically, from an engineering and technical background, got into healthcare because of the mission of it. What it really means and what it really signifies is effectively betterment of all of us. And that is basically something that gets most of us basically excited to really come to work every day and basically like grind through all of the problems that we are sort of really having like in healthcare. And Story is like, I think, like an incredible example of that, right? Like the kind of, even if you're able to drive that outcome for one patient, it's meaningful enough. And imagine when you can do that for millions of patients, the kind of impact that you can create as a technologist is just like something that you really crave for every day, right? Like there is a bunch of like things that are happening on tech generally, like I think in AI, building models and a bunch of those things. But how do you apply that in causes that really help all of us is the real problem to effectively solve. And so I'm super excited about like I think the kind of use cases that Tom and team have basically been working on, and how can we expand it across like various specialties? How can we basically think about more specialties over a period of time and really expand this to be like a holistic way that care transformation can happen at scale. So it brings me like I think incredible excitement for what we can sort of really accomplish together, and I can't be like more excited.
That makes sense. You know, we've all seen the promise of technology and how it can help. But the challenge is we often sell technology to people who aren't quite sure how to use it. And then we've got specialists in primary care and fee-for-service, and all this stuff doesn't come together. But I'm hearing a potential for it. And I heard you say earlier, Abhinav, thinking about being reimbursed for outcomes. That brings people together around one common goal, why we're passionate about solving this problem in healthcare. And we're also interested in partnering with you. So if you scan the QR code or click on the link that's available to you, it'll provide you more information so that we can start to work with your organization soon.